Then our next speaker is Professor Dr. Nidhi Nagabhatla. She is Senior Fellow and Cluster Coordinator for the Cluster Nature, Climate and Health at the United Nations University Belgium. As a sustainability science specialist and systems analysis with more than 20 years of work experience, she has led coordinated and implemented transdisciplinary projects in various geographical areas in Asia, Africa, Europe, and the Americas, working with international organizations and leading research and capacity development initiatives. She's affiliated with Oxford University and Leibniz University in various roles, mostly related to sustainability research, science policy interfacing, and mentoring young professionals. Please welcome her to the stage.
Good afternoon, everyone. And thanks for the kind introduction. I should also thank the two speakers before me who've set a very nice tone for me to carry you through the sustainability domain, which is, of course, very vague, wide, but sensible as well at the same time. And having said that, I'm very delighted to be here with you, to be sharing some of the insights that I've observed, learned, and exchanged with colleagues, friends, and institutions along my professional journey and personal experiences. And I'm going to try my luck with this. Okay, so it seems it works. I'm going to maybe put a question and we can agree or disagree at the end of my talk. The Sustainable Development Riddle. Of course, states, international agencies, agendas have made big promises and gradual progress over the course of whenever we organize ourselves. And United Nations is one such organization through which many states have organized their agendas for a common goal of sustainable future for all and for humanity. So I'm going to be giving you more or less some food for thought, what United Nations agencies, actors, and programs are doing to interface health in several other domains related to sustainability. And we'll also talk about the nice buzzwords that are around the implementation of these mega agendas, like leaving no one behind, building back better, whatever they mean something when we think about implementation of these big goals. And I'll give you some insights, and then we'll see if really they mean sense, or there is a lot of learning we have to put through these big words or buzzwords to make some sense of them. But let me take you to 2000. I know I was just finishing my master's at that time. I was looking whether I should do a PhD or a job, and I was leaning towards to taking a job. But I thought that if I sort of lose the practice of sitting and studying, will I be ever able to do a PhD? And I was in a conundrum. But this was the time that I heard about Millennium Development Goals. That was a sort of a launch of Millennium Development Goals. If I'm not wrong, it was somewhere in September or October of that year. And I'm sure that some of you were in primary or secondary school, well, or maybe trying to shape shape some dreams of what you like to begin. But I think overall, as a scholar who was primarily being raised in a developing country, I studied and I was born in India. And I was thinking, well, this is a very interesting agenda. And there's a lot of talk about global commitment pledged by developed and emerging world to understand what key challenges our humanity is facing, do some collective thinking. And that was sort of an inspiring time where I then decided to do PhD instead of taking a job. And there goes 15 years. I finished my PhD postdoc, some professional experience as well, and joined the UN in 2014. And then 2015, while the world, the states, the agencies were building databases, monitoring and evaluation of how far have we gone in achieving the Millennium Development Goals. They were also discussing the launch of Sustainable Development Goals, how MDGs, as we call them in short, were very oriented to building a world that is free of health problems, that's free of sexual violence, that's very oriented to gender issues, especially women. Sustainable Development Goal was now taking a very comprehensive, overarching view of incorporating business, consumption, production patterns, trade, institutions, peace and political stability, governance, gaps and needs, food security, energy security, and everything that you can think in the name of sustainability. It is a mega agenda. One would argue, why do we actually need 617 goals, 179 targets, and so many indicators to measure? It's a big burden for countries who don't have enough financial capacity, human capacity to report, monitor, and kind of fix these problems within the span of 15 years that SDGs have given us. 2015 to 2030, we are already in the midway, and we are very far from reaching some of these agreed agendas. But the good thing is it's given an opportunity, a global stage for problems that concern humanity, that may by and large be more prominent in some parts of the world, like in global south, but that also have direct and indirect impact on populations, communities, political stability spectrum in the global north. So this exchange between north and south is one outcome that is anticipated of the sustainable development goals. The second important thing is that it's giving us a landscape or a sort of a platform to discuss what integration means, what integrated agendas look like, or giving us some food for thought to start thinking that there are intersections and there are interlinkages and there are interconnections between different goals, between the goal of food security, between the goal of health security, peace and political security as well. Now, I'm going to be leaning to speak more towards the water sector because I'm a trained water scientist. The human right to water and sanitation, that was a UN global governance mechanism that was endorsed by many member states of the UN, had outlined the role of water into the well-being, the psychosocial conditions of communities around the world, defining and observing the trends and patterns, how by 2025, by one projection, half of the world population will be under some kind of water stress. And this might be a projection then, but now it's a reality. The floods of last year in Europe and the drought this year in some parts of Europe is making this reality even more prominent. But I just wanted to give you that impression that as the water agenda is very central to sustainability and sustainable development goals. A lot of work has been done in creating databases, in creating spaces for exchange of information and knowledge. And we are really looking forward to March 2023, when after many decades, global actors and agencies working in the water sector will come together in New York for the UN 2023 Water Conference. Why is this? This is a milestone. Why? Because many countries, many communities around the world still go kilometers to fetch for water for their daily needs. Sanitation, which requires water, is millions of people don't have regular or sanitation needs or service provision. So we are very far from making health goals related to water a reality if we don't have water security for all. Water security was also a contentious word because water is not territorial. We share water with our neighboring countries. It's not like land that we can make rules and we can all follow within the context of a nation. When we have to make water laws for shared water systems, we have to be very careful in building consensus, in agreeing to arrangements and agreements that all parties adhere to. So water security took a long time to become an accepted word and definition in the UN system. But these two water decades, so 10 years of deliberation from 2005 to 2015, and the next water decade that started 2018 to 2028. Why 10 years of discussion to agree on something? Because again, building consensus between what should water security agenda look like? A working definition was agreed. Well, as a scientist, I felt that it was very wide ranging, but I think from a practitioner's viewpoint, it gives them the ability to take note of relatively under reflected dimensions in the water management or water governance at the local level. And the word pollution is a direct connection with the health sector because due to lack of wastewater management facilities, due to lack of water for drinking and sanitation needs, the health consequences, the health burden of from the water sector was evaluated to be huge. Well, another concept, and this again, I'll not go into detail, is planetary boundaries. This is again another food for thought where the scientist and the scholarly community is trying to understand thresholds and tipping points, as the professor also alluded to. But these thresholds again are very difficult to quantify. It again can be a guiding framework, but to have operational measures to implement this framework at the local level, subnational level, is a challenging task. But at least it gives us a it is giving us some sort of let me call it a cautious call that we have as a global community are very near to some tipping points. For example, if we don't have enough hydrological flow or surface flow in some rivers around the world, how are we going to guarantee drinking water and sanitation supply to our citizens? If we have dry spells, do we have enough infrastructure? Do we have enough capacity? Do we have commitment to store water for those dry periods? So the connection between climate change, water needs, water provisioning, water as a human right, and the consequences of crisis that communities have to face. I would also point in my next slide to another agenda that UN has led for the past 10 years, the Intergovernmental Science Policy Platform on Biodiversity and Ecosystem Services. This again was a milestone because I'm glad I was personally involved in it, because the construct of biodiversity and ecosystem policies were made central to the health outcomes, to the well-being concept of for communities, for sustainable futures for all. And health was projected as something that remains central, why we should protect and conserve our ecosystems, why we should renew our bond with nature and natural resources. And if you see the conceptual framework that went along with this messaging, you can see that it's constructed all around the good quality of life and well-being concept. So again, this is another entry point to the health agenda, to the global health discourse, making and rebonding with nature to protect nature for healthy communities. Healthy nature is a prerequisite. Of course, after this, last year, there was another big commitment. And these commitments remain important because here we are talking about, when you talk about global health, we are talking about global actors. We are talking about several 100 countries. And then again, agencies who are responsible for managing different portfolios, be it land portfolio, food security portfolio, water security portfolio. So bringing these actors together on a global stage is no less than a circus. And I'm sure you must have all heard about the climate circus every year, the COPs. So these institutional mechanisms are necessary. Perhaps they may not come out with desired outcomes, but they give us a platform to bringing all these actors and agencies together to agree or to even disagree on an agenda, but to have an agenda on the table, to have a common agenda on the table for sustainable futures for all. And the UN Decade on Ecosystem Restoration is again one such agenda that speaks to all the other multi-level governance mechanisms that you can see listed from biodiversity, from climate change, from the Bonn Challenge, from the Paris Agreement, from Ramsar's agreement that talks about our water and lakes and other water systems around the world. So maybe I'll take a pause here and I'll ask you if someone can give me an answer on this. How many multilateral environmental agreements do you think we have agreed as members of the United Nations? 100, 200, 500? So who thinks it's 100? 200? 500? Well, it's much more uh, than 500. So we have 500 agendas. We have agreed at the global community, and still we are talking about SDGs, and we'll still talk about post 2030 agenda. So I think something is wrong somewhere, and we have to do that diagnosis from various lenses. And health, of course, global health security is one such lens for sure. Well, just to give you a glimpse on when we agree to these agendas, what do we actually do there? I mean, we are given a big file of documents, and now you have to sit and organize some plan, like, again, an implementation plan and some kind of intervention plan. And it will have several committees. But again, everything is justified in the sense that the work implementation is huge. And so the idea of these big declarations at the global level is also to take stock of gaps and needs. And I'll make it simple, but it involves a very systematic consultation at national levels, at subnational levels, to see that it has the voice and representation of several communities, including communities who have been traditionally left behind, like the indigenous groups, like people who live in vulnerable settings. So just to give you a glimpse of the process and how we take our stock and then how sort of we compile the responses. So it's done in a sort of a consultative manner to the extent possible, depending on financial and human resources that we have in hand. Well, a good news for all of you people of the young generation, maybe I can also count myself because I'm on the crossroad, is that sometimes these agendas also help to bring a momentum for young professionals to be a part of the discourse, to be getting a platform to have their voice, to have a seat on the table. And generation restoration, the term that we had along with this declaration, was giving an opportunity for young people to organize their insights, their perspectives, their knowledge to participate. And there are several opportunities through projects, programs, initiative, and activities through which they can engage. And this is, I think, the most important part of this agenda, because young professionals are leaders of tomorrow. And if they're trained right today, we can expect that they will carry on the mandate to make sustainability a reality. Working on several domains, and I'm going to also touch on the health side of the water sector. A lot of interconnection between the water health nexus is through the wastewater. Of course, the water and sanitation is one big central part of it, but wastewater and the impacts of wastewater on societies as a health burden, especially in the global south, is something that is core to our research and investigation. And we have been working closely with other UN agencies, especially in terms of climate change and disaster risk reduction, and also nature-based solutions. So working out solutions that are not necessarily very infrastructure based, as we have done in the past, but solutions that can apply the more of nature knowledge into kind of achieving desired outcomes. And I'll give you one very good example of that. Many countries, especially developed countries, are able to construct wastewater treatment plants. So they are able to take the waste water coming from municipal or industrial side into these treatment plants, and then they can recycle, reuse water. So the wastewater or the polluted water does not contaminate the landscape that we live in. But just only 30% of the world. More than 70% of the world is releasing wastewater directly into our natural water resources. And these are the water resources we get our food from. the fisheries, the aquaculture, these are all connected sectors. Our food on the table is coming from everywhere in the world. Of course, there are quality measures, but are we able to detect everything that translates from contaminated water into food? So this intersection is of key importance to water scientists and to make that connection directly with health. I'm also going to leave you with some more insights if I have time. An emerging discourse on human mobility patterns, either directly or indirectly influenced by climate change and other disasters. You see on the map, in 2015, we already crossed the threshold of people being displaced by violent conflicts. More than 20 million were displaced by disasters. And these blue circles that you see on the map is already making a case that climate change is a key causality for forced displacement and migration. And when we talk about that, we also are indirectly or directly talking about political and geopolitical stability and conflicts. Where does the health fit in? So again, giving you a map of that, these disaster events are not just limited to developing or emerging economies, but a lot more frequent and common in the developed world. To be able to deconstruct this nexus, we have to start somewhere. So last year, we released a report where we were able to make a framework so that we can give researchers, the funding communities, the international agencies, some framework to start with. And this framework on the screen is constructed in a very simple, flexible manner, so people can adapt, and customize it to their own context. But it's a significant point of the framework is that the health burden of disasters of climate change is significantly represented in the framework. So again, I wanted to make a case for the health intersection with the water world sustainability goals, and the One Health approach that the WHO is leading. After COVID, a lot of thinking got into sort of from analysis to synthesis. So should we sit down and start kind of piecing together in a more better manner the interconnections that combine ecosystem health, human health, livestock health. And the One Health concept is still being discussed, is deconstructed for application, but I think it's signaling something promising, so to speak. In terms of understanding linkages, and the word interlinkages is again meaning a lot in the research and development arena, especially for sustainability scientists. We've been trying to see how sustainable development goals can be addressed in tandem, so that they are not really isolated in these boxes that they are framed, but they become inspiration for researchers, for practitioners, for resource managers to be able to pick up goals that directly or indirectly relate to each other. And some of them, as you see on the screen, when you talk about water, the water needs, the water sanitation, drinking water, you're already talking about maternal health, you're already talking about reproductive health, you're talking about the gender gaps. So these interconnections we are trying to deconstruct in several of our projects and programs. And some of the initial insights from a systematic review that we conducted on water and gender interlinkages, a key take-home message was that in 70% of the cases in the water and the gender research, reported a health outcome. So when you talk about physical health outcomes like musculoskeletal problems for women who go to distances fetching water, have to take the burden of water provisioning for their household level, 70% of these cases had health outcomes where the gender burden of water provisioning was central. And I think why the interlinkages is also key, and this is my closing remark, is because I think we have enough tools as a kind of community of academics, research scholars, agency, and institutions. We have enough to use several channels. Like one could be science diplomacy, one is science policy interfacing in a more systematic, clear manner through our education system, through our professional job space. And why is this so important? I mean, this is an important agenda that we all have to embrace, using our own skill set, using our own thematic domains, because for 5 years, one such factor of one such thing that I've noted on the screen is the World Economic Forum risk reports. For the last during the last 5 years, you can see this whole global risk spectrum is full of climate change, natural disasters, health outcomes, and these factors can't be addressed alone by one community because, or one thematic set of experts, because they are inherently and organically connected. And I think from our side, we have done several reports to provide that evidence. And I'm going to leave you with that. The ongoing decade for action for water and sustainable development, 2018 to 2028, is ongoing. So maybe you can take some inspiration to frame your research agendas, to look into these intersections, to ensure that the research is feeding into the policy sector, and we can together and collectively achieve sustainable futures for all. Thank you.
Thank you, Professor Nidhi Nagabhatla, for your presentation and for your inspirational insights into sustainability thinking.